most famous physical therapist on the internet.
Hi, folks. I'm Bob Schultz, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to show you how to improve walking with less arthritic pain with 7 at-home exercises and therapist tips.
Right.
Walk on.
There you go, Bob. We don't have to do all 7 of them, but get through them. You're going to find probably at least 1 or 2 that are really going to get to the point.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com because we're always doing a giveaway. Go to the giveaway section, and you'll see this week we are giving away a Fit Glide.
There you go, Bob.
We'll show this later.
Yeah, it actually is one of our little tricks.
Yep. You can also find the contest pinned to the top of the page at Facebook. Go to Twitter or Instagram or TikTok if you want a 60-second version of our program. You always get to throw it. I'll get to throw it.
Yeah, it's very fun, isn't it?
Yeah.
Yeah. Okay, so, Bob, we had some pretty good responses on a recent walking video, and I wanted to do a little more research and see if I could find some science into it. And so I did. I spent quite a bit of time on looking at different research articles, and I found out they all had very similar results and advice on what to do to improve your walking with less pain and so you can walk farther. And what they did is, with research, they're always using something to get numbers.
Some type of test.
That's the science. And we need to do that so we have some good, clear evidence. One of them was the WOMAC, W-O-M-A-C. I don't want to bore you to death here, but just so you know, there was some good research. This is called the Western Ontario and McMaster University Arthritic Index. So this is a test for people who have arthritis in their knees, hips, ankles, etc. And it relates to that. And also the 6-minute walk test, which we are very familiar with. We use it in the clinic on a regular basis.
So basically they applied these tests, then had you do the exercises.
Exactly.
And then what? Month later, 6 months later.
Typically 4 to 6 weeks.
4 to 6 weeks later, they check it again, and you've improved.
Exactly. So they found notable, significant, as we say in research, improvement on all of these studies. So here are some of the common exercises that they use.
Let's go.
Here we go. I'm going to sit this way. And Bob's going to sit that way.
Face this way.
This is the old standard. A lot of these there's no magic to them. It's the long arc quad or knee extension. And so you just kick straight out, try to get as straight as you can, and back down with a bend in the knee. Bob's foot's not touching. That actually works better.
Yeah, I can swing her back and forth.
Yeah. If you're touching the floor, make sure you don't do this. Do 10 of these on each leg, not too fast, nice slow. Out and hold it for just a little bit and then come back. Okay, 10 on each leg. Now, the next one happens to be a nice exercise for those, if you have really knee pain, good arthritic knee pain, not good, but bad, I should say. And that's where the Fit Glide, the giveaway that actually Bob and I did invent this, works very well. And this is one of the reasons we did, as you put on the floor right below the chair.
Yeah, it's meant to be used in a seated position. It does have a slight sound to it, the swish swish. It's not silent. But the big advantage is this thing is so lightweight. You can carry this anywhere. And if you're elderly, it's only 5 pounds. So if you can carry 5 pounds, you can carry this. And it's got a little, well, you want to show the flip up, Brad?
Oh, yeah, it's got a little stilt so you can put it at an incline. And it emphasizes quadricep strength this way while getting the knee motion, which is going to help that arthritic pain. And then do it this way, and that actually gets the hamstrings. And this is it looks like a very simple exercise, but you do this for 2 or 3 minutes.
Yeah, you'll
even myself, I'm quite fit. I can feel those muscles starting to warm up, and you'll get them fatigued. So it's a good exercise.
Now, it's all we're trying to do is get some movement in all the joints. And so as an alternative, you could use a stationary bike too.
Absolutely. And the big advantage of that is you also get the hip, the knee, and some ankle joint movement. So you're getting all of these joints moving, you're getting the muscles working. The only thing about that, there's a cost involved with that.
Right, and they take up space.
And they're not easy to move.
Well, a lot of people think that's where you end up putting your laundry on.
Yeah, you gotta dry that sweater, put it up on the stationary bike. But not everyone. A lot of people do use them on a regular basis. And number 4 is seated knee extension.
Now, this is actually a stretch.
It is, Bob. But I'm still going to include it because
Yeah.
when you walk, if your knee does not straighten out when your heel comes down, that's a normal mechanical action of the knee. And if it stays flexed, that can start to cause problems in the knee.
Well, one thing you could do is you can compare both knees.
Yep.
You can sit down. You're probably be better
Yep.
show it, Brad.
So let's say this knee goes straight and the other knee
Doesn't go all the way
look at
down.
the height difference. So we're going to work on this one to see if we can get that straighter. So this is the exercise. I'm going to show it on this leg. If it doesn't go straight, you're just going to get it and put some gentle pressure above the kneecap. Don't push on the kneecap. That can irritate it. And gentle pressure on and off. And on and off.
And what they found is that, any gain in motion tends to decrease the arthritis.
Yep.
I mean, I've seen this happen many times. Don't get too crazy the first time.
There you go. I think
maybe-
you had that one
Yeah.
story with a patient that
Yeah.
he got pretty crazy
And-
at home.
Yeah. Well, he got crazy at therapy.
At therapy.
And
Well, not crazy. He got aggressive on the exercise.
and he was upset the next time. In fact, he said he almost didn't come back in.
because he went too hard on it.
Yeah, and
it
it
got
got
sore
sore.
afterwards.
But then in the end, it really helped him. So
Mhm.
I was back in his favor.
Yeah, so
It
be
took a little bit.
gentle on it the first day, even if it doesn't hurt. Just time to test it out. After a couple of days of doing it, you'll know how your body responds.
Now, that one thing about this stretch, you can do it a lot. You can do it
Sure.
throughout the day. You
Yep.
can do it 6 to 8 times. I mean, not the first day.
Not the first day, or maybe even the second day, but as you get into
as you
it,
progress.
there you go. We want to keep people smiling,
Yeah.
Bob. Now the next one is want to work on bending the knee.
Right.
And the nice thing
You
about
can do it seated.
you can do it seated or lying down. I said it right, Bob. Lying down.
You said it
Not
right.
laying, because a chicken lays eggs. We lie
We
down.
lie down.
Something like that. For the English majors. So this also works the hip. So in a seated position or lying
And
down.
again, I kind of like the pressure on, pressure off.
Yep. Now, if your knee hurts when you grab over the top on the shin,
You can
because
grab underneath.
yeah, grab underneath and work it that way. That's a great little trick. And then you get in the hip. Boy, I've got a patient now. He's 59 years old, and his hips are so tight, Bob. We've got him. I'm going to do a video for him actually.
Yeah, 59.
Yeah, it's.
That's what,
It's a
2 years for you? 1 year for you?
Well, I can't remember, Bob.
All right, I'm going to do the clamshell.
Yep.
Supine or sideline?
Well, you can do it sideline or supine. I was thinking supine on your back, but
Sure.
that way it kind of works both of them together. And this one,
Well, it
we-
depends. If you want strengthening, you got to get it from this way.
right? Yeah, you're doing the top
Yeah.
one. Yep.
Yeah, then you're strengthening the upper one.
Yep.
The other one, it's just really range of motion and stretch a little bit.
Right.
So you got to determine what your goal is
Right.
with that. And
Which-
obviously, I'd lie on my other side too.
Yep. So you can do it right side and left side, or on your back, or seated, as I'm doing here. You're still going to get some hip motion.
And how many of these are we doing, Brad?
10.
10,
10
okay.
out of all these. Relax while you're
Sure.
doing them. Do not go, if any of them create sharp pain, back off of it. Just avoid that exercise. You can come back to it, and it should improve as you do the other ones that help. Now, last but not least,
I would think this is almost one of the most important stretches you can do
right,
to the hip.
exactly, and that's hip extension. In other words, bringing it backwards behind you.
Because what happens is, as we sit a lot, which we all do, those muscles shorten up
In
and
the
they
front.
start limiting the motion of your hip, and they start giving you problems. Now, you can do it off the edge of the bed, but you got to be very careful that you just move your hips to the edge of the bed and keep your body well onto it.
Right.
And I'm going to lower this one down like this,
Yep.
and then I'm going to bring this one up.
Yep.
And you can see, watch this, my hip actually raises up.
Right.
There's a little bit of tightness there.
Yeah, and so that's stretching the hip flexors, okay? They're deep. They're actually kind of inside the abdomen a little bit, and right where that pocket is. So they're deep muscles, and you can see Bob's leg. It's a subtle movement, but as a therapist, it's very clear to us. So we're training you to become therapists. Now, that's a nice way to do it. The other way to do it is if you take a pillow or if you got a nice carpeted floor. I'm going to work on my right hip. It's nice to have a little cushion on your knee, particularly, because especially if you got a little arthritis. And I'm going to go like this, hand right here, try to keep good posture, and just simply lean forward and right in there you'll feel those muscles stretch.
He's giving a little push with his hand
Yep,
there, and
yep.
you don't necessarily have to do it the first time, but as time goes on,
Yep.
you want to give a little extra push.
Because this one is, I mean, I can feel it. I do not do this one on a regular basis. I've got some other ones that I work at, but my hips I feel pretty
Yeah, you're
pretty
you
good about.
You got pretty good mobility.
Now your hips, you do this on a
Yeah,
regular
I
basis,
do it on
don't
a
you,
regular
Bob?
basis.
Yep. So 5 to 10 reps on each one. How many reps do you do, Bob?
I do. I don't know if I count even.
Yeah,
it's the
after you
time
do
of-
them for a while,
yeah,
you get
in
a
the
rhythm.
morning, you're just kind of in a meditative state.
Yeah.
I don't even.
Face it, you're still sleeping, aren't
Well,
you?
sometimes I gotta even think, did I do it yet? And I go, did I do that?
You
So-
get into a routine and your body goes on autopilot.
That's right.
So very good. Loosen up those knees and hips and ankles. Keep yourself walking. There's one tip that I do want to mention, Bob.
Sure.
Once you start being able to walk better with less knee and hip pain, if you have back pain, the more you walk, if you walk on the flat, your back pain is more than likely going to come down as well.
Yep. Walking is a huge part of treating back pain.
Absolutely.
Not well known by many people.
Everything fits together from the waist on down when you're walking. So actually above the waist, the back on down. I'm sorry.
Neck up.
Don't talk to me about the neck up, Bob. I don't go there.
Yeah.
I've got enough problems.
All right.
So, anyways, very good. Thanks for coming
Peace.
in. Richard Nixon.
There we go. I'm not a crook.
We better get off the line here.